Hello guys, welcome back. This is a crash course series. It is assumed that the student has undergone through the various details of the subject, and this is just the quick revision of the facts. So let's begin with anatomy. So this is an embryo, and when we study about pharyngeal arches, so a developing embryo has got 6 pharyngeal arches. So 5th pharyngeal arch, it gets rudimentary. So talking about the first pharyngeal arch, it forms the maxillary process as well as the mandibular process. So this is going to be the first pharyngeal arch. Second pharyngeal arch is going to be this one. So first pharyngeal arch is supplied by the mandibular division of the trigeminal nerve. So basically we can say the mandible is supplied by the mandibular division of the trigeminal nerve, which is the 5th cranial nerve. So we can remember 5. Cranial number 5 helps in development of the first pharyngeal arch or supplies the first pharyngeal arch. Second pharyngeal arch is supplied by the facial nerve. So it is supplied by the 7th cranial nerve. Third pharyngeal arch is supplied by glossopharyngeal nerve, which is the 9th cranial nerve. Fourth and 6th pharyngeal arches are supplied by the vagus nerve. Now we have 2 divisions of the vagus nerve. So the 4th pharyngeal arch is supplied by superior laryngeal nerve, which is a part of a vagus nerve. Also, the 6th pharyngeal arch is supplied by the vagus nerve. So which branch of the vagus nerve? It is recurrent laryngeal nerve. So both are supplied by the 10th cranial nerve, vagus nerve. When we talk about the nerve supply of the pharyngeal arches, so first pharyngeal arch is supplied by the 5th cranial nerve, second pharyngeal arch by the 7th cranial nerve. So 5th is going to be trigeminal, 7th is going to be facial. Third pharyngeal arch is supplied by 9th cranial nerve, that is the glossopharyngeal nerve, and 4th and 6th are supplied by the vagus nerve. So these are the 10th cranial nerve. Now when we see a person, so what are the pharyngeal arches which are going to develop these structures? See, this is a mandible, and if you draw a line, first up to structures up to here are supplied by first pharyngeal arch. So the structures that are supplied, that are contributed by the first pharyngeal arch, is going to be mandible. When we draw a hyoid bone here, so this is a lesser wing of the hyoid, then the greater wing of the hyoid. Now if you draw a line which is bisecting the hyoid bone, structures above this are supplied by the second pharyngeal arch. So lesser horn of the hyoid bone as well as the upper body of the hyoid bone are supplied by the second pharyngeal arch. While on the other hand, the greater horn of the hyoid bone as well as the lower part of the body is supplied by the or contributed by the third pharyngeal arch. Structures from 4th pharyngeal arch is going to be the thyroid cartilage as well as the epiglottis cartilage. These are the structures from the 4th pharyngeal arch. And when we talk about the ear ossicles, so we have malleus, incus and stapes. So malleus and incus are derivative of the first pharyngeal arch, while on the other hand, stapes is the derivative of the second pharyngeal arch. Likewise, we have anterior belly of digastric, which is a part of the first pharyngeal arch. Digastric, which is a part of the first pharyngeal arch. Posterior belly of digastric is a part of second pharyngeal arch. Now first pharyngeal arch gives rise to maxilla as well as mandible, and neural crest cells are going to form the mandible as well as the hyoid bone. So neural crest cells, they form the secondary mesoderm. Then what are the structures contributing to the primary mesoderm? So primary mesoderm is also known as paraaxial mesoderm. We have 2 kinds of mesoderm, primary and secondary. So secondary mesoderm, which is also known as paraaxial mesoderm, it gives rises to muscle of mastication, so the muscles. When we see this structure, so the outer layer is ectoderm The middle layer is mesoderm and the inner layer is going to be endoderm. Now we have mesoderm into primary and secondary. So primary mesoderm is also known as paraaxial mesoderm, and secondary mesoderm will form neural crest cells, and which will in turn form the pharyngeal arches. So the mesoderm, secondary mesoderm, forms the neural crest cells, which in turn form the pharyngeal arches. When we see mandible, it is a derivative of the first pharyngeal arch. Second pharyngeal arch derivatives are the lesser horn of the hyoid bone as well as the upper body of the hyoid bone. Third pharyngeal arch derivatives are the greater horn of the hyoid bone as well as the lower body of the hyoid bone. Fourth pharyngeal arch contributes to epiglottis as well as the thyroid cartilage. And sixth pharyngeal arch, so fourth, remember the first pharyngeal arch is supplied by the fifth cranial nerve, trigeminal nerve, second pharyngeal arch via the seventh cranial nerve, facial nerve, third via the ninth cranial nerve, glossopharyngeal nerve, and fourth and sixth via the vagus nerve. So fourth is by the superior laryngeal nerve and sixth is via the recurrent laryngeal nerve. So the derivatives of the sixth pharyngeal arches are cricoid, cuneiform, arytenoid and cornicoid, all these cartilages. Now the nerves of the pharyngeal arch is the first pharyngeal arch. It gives the fifth cranial nerve. It's a derivative of the fifth cranial nerve, which is the trigeminal nerve. So we can write mandibular division of the trigeminal nerve as well as a pre-tympanic branch which is arising from the second pharyngeal arch nerve. So second pharyngeal arch nerve is going to be the seventh cranial nerve, which is the facial nerve. A branch of the facial nerve gives pre-traumatic branch, which is the chorda tympani, and therefore this chorda tympani is going to supply the tongue, which is in the upper region, so above the mandible. So remember, the derivative of the first pharyngeal arch, the nerve of the first pharyngeal arch is mandibular division of the trigeminal nerve. The second one is the facial nerve. The third one is the glossopharyngeal nerve, the ninth cranial nerve. And a pre-traumatic branch of the glossopharyngeal nerve, which is a tympanic branch, it comes in the second pharyngeal arch. Now the nerve of the fourth pharyngeal arch is going to be superior laryngeal nerve, which is an internal branch of the vagus nerve. And the sixth pharyngeal arch via the recurrent laryngeal nerve, which is a posterior division of the vagus nerve. And in between these superior laryngeal and recurrent laryngeal nerve, there is a anastomosis which is known as Gallen's anastomosis. So let's revise the derivatives of the first pharyngeal arches. You can remember from the mnemonic, my aunt is super sweet and gorgeous. So the first pharyngeal arch derivative is known as the Meckel's cartilage, also known as quadrate. So my aunt is super sweet and gorgeous. M for Malleus. We remember we talked about two ear ossicles are derivative of first pharyngeal arch, Malleus and Incus, while on the other hand stapes or stapes is a derivative of the second pharyngeal arch. So M is, you can remember, mandible as well as maxilla, and M is also again Malleus. A is going to be the anterior ligament of Malleus. I is going to be Incus. S is a sphenomandibular ligament. And then we have G, that is going to be our digastric. You can remember anterior belly of digastric. So when we talk about the muscles of the first pharyngeal arch, we have 8 muscles. 4 are the muscles of mastication. So temporalis, masseter, medial pterygoid and lateral pterygoid. Now remember, all the muscle of mastication are going to close the mouth. That is, it is going to elevate the mandible. On the other hand, we have an exception here, that is the lateral pterygoid. So lateral pterygoid is going to open the mouth by depressing the mandible. So that is the exception out here. Another 4 muscles out of 8 of the first pharyngeal arch are tensor tympani, tensor palatini, mylohyoid and anterior belly of digastric. Now also remember that anterior 2/3 of the tongue is supplied by the first pharyngeal arch. So remember, when we talk about taste supply of anterior 2/3 of the tongue is via the chorda tympani branch of the facial nerve, which is a pre-traumatic branch that is of first pharyngeal arch. Now second pharyngeal arch is the Reacher's cartilage. So Reacher's cartilage, it is going to be supplied by the seventh cranial nerve, that is the facial nerve. The neural crest cells give rise to hyoid bone, upper body of hyoid and lesser horn of hyoid bone. Then stapes, which is the third ear ossicle, styloid process, stylohyoid ligament. When we talk about sphenomandibular ligament, which is a derivative of the first pharyngeal arch, while on the other hand stylohyoid ligament is a derivative of the second pharyngeal arch. So muscles that are arising from the primary mesoderm, so all the facial muscles are derivative of second pharyngeal arch, and therefore all the muscles of facial expression are supplied by the facial nerve. So all the muscles of facial expression, also along with that we have stapedius and stylohyoid. S and S you can remember, stapedius and stylohyoid. Again stapedius is supplied by the facial nerve, which is asked in the questions. Also posterior belly of digastric is supplied by the second pharyngeal arch by the facial nerve, while on the other hand anterior belly of digastric is supplied by the mandibular division of the trigeminal nerve, derivative of the first pharyngeal arch. The third pharyngeal arch is supplied by the glossopharyngeal nerve. So the neural crest cells, they form the hyoid, greater horn as well as the lower body of the hyoid. The muscles of the third pharyngeal arches, remember there is only one muscle, that is SP, you can remember, stylopharyngeus. So this is a derivative of the third pharyngeal arch. Therefore stylopharyngeus is supplied by glossopharyngeal nerve. Only muscle of pharynx that is supplied by glossopharyngeal nerve is the stylopharyngeus muscle. Again, when we talk about pharynx, we'll be talking about this point because it is a derivative of the third pharyngeal arch. Therefore, it is supplied by glossopharyngeal nerve. So, the muscle of the third pharyngeal arch is SP, remember, stylopharyngeus. Posterior 1/3 of the tongue is supplied by the glossopharyngeal nerve, which is again a derivative of the third pharyngeal arch. So first pharyngeal arch supplies the anterior 2/3 of the tongue. Third pharyngeal arch supplies the posterior 1/3 of the tongue. When we talk about derivatives of the fourth pharyngeal arch, we have superior laryngeal branch of the vagus nerve supplying the fourth pharyngeal arch. We have thyroid and epiglottis. The muscles, again palate and pharynx, only one muscle of which is supplied by only one muscle of the larynx, which is supplied by the superior laryngeal branch of the vagus nerve, which is a derivative of the fourth pharyngeal arch, is CT. Except that all the muscles of the larynx are supplied by the recurrent laryngeal nerve, which is a derivative of a sixth pharyngeal arch. So remember, only one muscle of the larynx is a derivative of fourth pharyngeal arch, which is CT, cricothyroid. Rest all the muscles of the larynx comes under sixth pharyngeal arch. So sixth pharyngeal arch, when we talk about, the derivatives are larynx, cricoid as well as the arytenoid, and it is supplied by the recurrent laryngeal nerve. Our question has been asked in NEET 2018 regarding the intrinsic muscles of the larynx are derivative of which pharyngeal arch. So all the muscles of the larynx, all the intrinsic muscles of the larynx are derivative of the sixth pharyngeal arch, except one, we have CT, cricothyroid, which is a derivative of the fourth pharyngeal arch. So when we talk about pouches and clefts, so pouches and cleft are basically present on inside. So outside we have are the pharyngeal arches, and inside we have pouches. So inside are the pouches, and again you can see that clefts are also present. So if you cut this embryo into half and look it from inside, this is how it looks from inside. Once we rotate this image, we are going to get a structure like this. So the derivative of the first cleft is the outer side, that is going to be external auditory meatus, that is the external ear. From inside pouches, it is going to be the middle ear cavity. And in between there is a tympanic membrane. So let's talk about the cleft first. So the first cleft give rise to external auditory meatus. Now as you can see, the second, third and the fourth pharyngeal cleft, they get obliterated. So they get obliterated, they descend down and they are going to form this sinus. This is known as cervical sinus, which is formed by obliteration of second, third and fourth cleft. If this sinus still persists in a person, then it forms a cyst. Now once we see the pharyngeal pouches, which are the inner lining, as you can see in the blue color, these are the inner lining. First pharyngeal pouch, it forms the middle ear cavity. Second pharyngeal pouch forms the epithelium of the tonsil. So remember, tonsil is derived from secondary mesoderm, which is a derivative of neural crest cells. We talked about secondary mesoderm forms the neural crest cells, primary mesoderm, which is a paraxial mesoderm, right? So second pharyngeal pouch derivative is the epithelium of the tonsil. If they ask you in a question, that tonsil is derived from secondary mesoderm, which is the neural crest cells. The third pharyngeal pouch, the dorsal part, the one in the red, the dorsal part, it gives rise to inferior parathyroid. So which is the dorsal part. The ventral part of the third pharyngeal pouch, it gives rise to thymus. So third pharyngeal pouch, the dorsal part, the upper one, outside one, the dorsal part forms the inferior parathyroid, while on the other hand, ventral part forms the thymus. Now talking about the fourth pharyngeal arch, which forms superior parathyroid. So third pharyngeal pouch forms inferior parathyroid, while the fourth pharyngeal pouch forms superior parathyroid. So inferior come first. Inferior parathyroid is derivative of third pharyngeal pouch, while superior parathyroid is a derivative of fourth pharyngeal pouch. Fifth pharyngeal pouch get rudimentary, there are some remnants in form of ultimate branchial body. So ultimate branchial body is a remnant of the fifth pharyngeal pouch. Now these pouches are inside, remember they are the endoderm origin. So when a question has been asked with the development of tonsil, so first answer is going to be the neural crest cells, because it is a secondary mesoderm or secondary mesoderm, any of it. This is going to be the first best choice. Second best choice can be a second pharyngeal pouch, because the epithelium of the tonsil is formed by the second pharyngeal pouch, or we can say tonsillar crypts. So endodermal epithelium of the tonsil is derived from the second pharyngeal pouch. Fourth and third and fourth pharyngeal pouch, if it get compromised or missing, this particular situation is seen in DiGeorge syndrome. So in case of people or children with DiGeorge syndrome or DiGeorge syndrome, in this case the third pharyngeal pouch and the fourth pharyngeal pouch are compromised. We know the derivative of the third pharyngeal pouch is, if you remember the third pharyngeal pouch, we have dorsal part is inferior parathyroid, ventral part is thymus. This is the third. When we say fourth pharyngeal pouch, then it forms the superior parathyroid. So in case of people with DiGeorge or DiGeorge syndrome, this third or fourth pharyngeal pouch is missing or compromised. So all the structures present in third and fourth pharyngeal pouch will be compromised. That is, there will be no thymus. If there is no thymus, which is present in the ventral surface of the third pouch, then there are no T lymphocytes. If there are no T lymphocytes, then the cell mediated immunity of the child is going to be very less. Therefore, there are very severe bacterial infection seen in the people with the DiGeorge syndrome. Also, because of the dorsal part contains or forms the inferior parathyroid, so there will be defect in inferior parathyroid as well. So there is going to be reduced or no parathyroid hormone, and because of that there is going to be reduced calcium level. When there are reduced calcium level, this condition we call it hypocalcemia, which is a condition seen in the tetanus. So the person or child can have tetany. There are also cardiac abnormalities which are associated because of these, and there can be anterior-posterior septum abnormalities which can be associated, and this can be the reason of death of child with DiGeorge syndrome. When we talk about cleft, so first cleft give rise to external auditory meatus. Second, third and fourth cleft, it get obliterated by the mesoderm of the second arch, and it forms the cervical sinus. This cervical sinus normally get disappeared. First, this cervical sinus form the cervical cyst, and this cervical cyst normally get disappear in the normal people, but if it persists, it is going to form the brachial cyst. So remember, in the surgery, when we say location of the brachial cyst, so it is going to be near the angle of the mandible, anterior to the sternocleidomastoid muscle. So this is the location of the brachial cyst. While on the other hand, thyroglossal duct cyst present in the midline. So brachial cyst is present anterior aspect of the anterior border of sternocleidomastoid near the angle of the mandible. While on the other hand, this is brachial cyst. If there is brachial sinus or fistula, they are present at the more lower level in neck. So the pouches, first pouch contains forms middle ear cavity or eustachian tube. Second pouch forms the epithelium of the tonsil. So tonsil is formed from the neural crest cells, which is the secondary mesoderm, but the epithelium of the tonsil is from the second pouch. Third pouch, the dorsal aspect forms the inferior parathyroid, ventral aspect forms the thymus. Fourth pharyngeal pouch forms the superior parathyroid. In case of DiGeorge syndrome, there is compromise of third and fourth pharyngeal pouch. The fifth pouch regresses and it forms the ultimate branchial body. So there is question that has been asked, derivative of the parafollicular C cells. Now let's talk about this ultimate branchial body. So ultimate branchial body is a regression of the fifth pouch. Now what happens, these neural crest cells, they reaches to the ultimate branchial body which regresses. This ultimate branchial body is going to make some changes in the parafollicular C cells. Then this parafollicular C cells releases calcitonin hormone. So the derivative of the parafollicular C cells, the first best choice is going to be neural crest cells. Second best choice is going to be the ultimate branchial body. If not in the option, third best choice is going to be pouch number 4. Because the fifth pouch fuses to the fourth pouch. Therefore, if fifth pouch is not in the option, which is the ultimate branchial body, then we can also go for the pouch number 4, and the fourth is going to be pouch number 5, because there is no such term known as pouch number 5, since the fifth pouch it regresses.